Janet Garner, the Comensus Coordinator of Service User and Carer Involvement at University of Central Lancashire.
Thank you, Janet. So can you describe one public involvement and engagement activity that you have been involved in that you're particularly proud of?
So day to day, I coordinate the Comensus Community Engagement and Service User Involvement Group at the university. And I suppose I'm most proud of being involved with that group now for around 15 years in different roles, but in maintaining relationships with the volunteers and encouraging them to not only become involved in the health and social care programmes, but they also support me and go out and do outreach and engagement events to spread the word and recruit new people too.
Have you found any challenges to finding people to get involved?
Yep, certainly there are challenges. So I think everybody in this area of work struggles to engage with particularly demographics of people. So perhaps young people, people who are working or of working age as well, people who have less time to give. So perhaps people who are, unpaid carers as well, or parents. But also people from minority ethnic communities, perhaps because of language barriers or mistrust or lack of awareness of what the work involves.
Is there anything in particularly you feel is not gone well or as planned in terms of your PIE activity?
No, I think something to bear in mind, because I think over the years we've organised and delivered many public engagement events. I think you can never underestimate the amount of planning that's involved, the amount of awareness raising and planning for every eventuality, really. So considering accessibility, inclusivity, in terms of the materials that you develop to support it, but also navigating your way through, in my case, university systems to facilitate that. So opening up buildings, making arrangements to reimburse people for travel, organising some catering, that's always very important as well. And keeping everybody engaged and happy and making sure that people are comfortable is the most important thing. And also being able to address different levels of knowledge and understanding, and, as I said before, language barriers as well.
Can you tell me about 2 key lessons you've learnt from your experience of being involved in PIE activity?
I think one of the key lessons, I think, is about relationship building and building trust amongst people. So particularly if it's a project, a piece of work that you're developing, whether it's a research project or if it's just an awareness raising, it's about making those connections with people and perhaps just hanging out with them really 2 or 3 times before you lead into the work project. But also understanding what's in it for them. We know what's in it for us. It's part of our work. We believe that it's an important contribution to the academic work that we do here at the university, but there's got to be some benefit for the community or for the volunteers themselves, and so making that clear to people as well. And we rely on our volunteers as well to reinforce that message.
What would you say is one of the biggest challenges facing meaningful PIE activity related to health research? And would you have any suggestions in terms of overcoming these?
One of the biggest challenges, well, there are quite a few, aren't there? But I mean, I think, again, for us, it's about having the right systems in place. So I think one of the challenges when you're working in health research with the NHS or with the universities is navigating the systems, the financial and the resource systems, you know, signing legal contracts, that all takes a lot of time. And also the time that it takes at the end of the project, where the researcher's gone away to write things up, or, you know, there's gaps where the public may see that there's, or perceive that there's nothing happening, where in fact there is. So it's keeping everybody informed regularly, and communication is key.
What would be your top tip to someone starting PIE for health research for the first time?
I think my top tip would be to understand what's already going on in the community. So not thinking you've got to start something from scratch. You know, do your research in terms of what is already happening, and make connections through those networks, really. So you're not having to do things right from the beginning again, that perhaps you ask for an invite to a meeting that's already happening, where you can explain the fundamentals of your research project.
And last question, what tip would you give for sustainability of a PIE activity?
I think, again, it would be regular communication is fundamental. Being open and honest about the challenges and the benefits of what's involved in a project. Keep people informed about, you know, the time length of when you might hear from us again. I think, for example, recently I've been involved with facilitating a public involvement project over with Liverpool services, and there's been a gap for a couple of months while finance is sorted out for the next phase. And in that gap, obviously, people aren't hearing anything. So I've been trying to make send some communications out about, you know, the waiting time and what's been going on in that period.
Thank you very much, Janet.
Thank you.